So if you've had a long history of hip pain in this region here, and it's recently been exacerbated by some exercise, then it may be you have some early arthritic changes to the hip joint itself.
So it's advisable just to cut down on your activity, and particularly your weight-bearing activity, but just some nice exercises just to keep the hip moving are just standing on your good leg and just bringing the affected knee up towards you, and then out to the side, and then also taking that leg back behind you. So trying to do about 5 to 10 repetitions in each direction will just keep the hip moving.
But if you're finding those exercises are a little bit too irritable, then if you can find a step at home or just on your bottom step of your stairs, as Kate's doing here, just letting that other leg just hang down, and you're getting a distraction effect to the actual hip joint itself, and that can really help calm things down.
So another really good tip if you are doing a bit of walking is to use walking poles, and that can just redistribute the weight just to take the pressure off the hip joint itself as well.
There's also some really good evidence for using non or reduced weight bearing exercise to help reduce the symptoms of hip arthritic pain. And there's some really good research which has come from Bournemouth University, undertaken by local orthopaedic consultant Rob Middleton and Associate Professor Tom Wainwright. And that's really shown the benefits of using cycling to help reduce the symptoms of hip arthritis in the early stages.
So if you have got a bike, then you could dust that off, or if you've got a static bike, then just starting off nice and gently and then just building up from there. So hopefully that's given you some helpful advice if you have got hip pain, but obviously if you have got any questions, then please feel free to contact us.